Hello and welcome to Pharma Hut and Health. In this video we will discuss on the emergency contraceptive pill, Levonorgestrel. What it is, how it works, the dosage, potential side effects, and how it can be used as an abortion pill. Levonorgestrel as an emergency contraceptive. Levonorgestrel is a type of emergency contraceptive pill that is used to prevent pregnancy after unprotected sex or if a regular contraceptive method has failed. It contains a synthetic version of the hormone progesterone, which prevents ovulation and thickens the cervical mucus to prevent the sperm from fertilizing an egg. Dosage. Levonorgestrel is typically taken orally and is available in a single dose of 1.5 milligrams. It is most effective if taken within 72 hours after unprotected sex, but can still be effective up to 120 hours, 5 days, after. Uses. Levonorgestrel is primarily used as an emergency contraceptive to prevent pregnancy after unprotected sex or contraceptive failure. Side effects. The most common side effects of levonorgestrel include nausea, vomiting, headache, dizziness, and fatigue. It can also cause changes in menstrual bleeding, such as earlier or later periods, or heavier or lighter bleeding than normal. Levonorgestrel as an abortion pill. Levonorgestrel can also be used as an abortion pill, but it is only effective in the very early stages of pregnancy. Dosage. The dosage for using levonorgestrel as an abortion pill is higher than that used for emergency contraception. It is typically taken in 2 doses, 12 hours apart, of 1.5 milligrams each. Uses. Levonorgestrel can be used as an abortion pill to terminate a pregnancy that is up to 10 weeks, 70 days, gestation. How many tablets are safe of levonorgestrel to take in a month? Levonorgestrel is intended for emergency use only and should not be used as a regular form of birth control. It is recommended to take it only once per menstrual cycle and to wait until the next menstrual cycle before taking it again. Taking levonorgestrel more frequently than recommended can increase the risk of side effects and may not be effective in preventing pregnancy. Levonorgestrel single tablet can be taken 2 times in a month after taking the first dose. If there is no menses, then the tablet can be repeat after 15 days from first dose, as it is not intended for regular use. If you are seeking a regular form of birth control, there are many other safe and effective options available. Side effects. The side effects of using levonorgestrel as an abortion pill are similar to those of using it as an emergency contraceptive. However, the bleeding and cramping can be more severe and may last for several days or weeks. In conclusion, levonorgestrel is a commonly used emergency contraceptive pill that can prevent pregnancy after unprotected sex or contraceptive failure. It can also be used as an abortion pill, but it is only effective in the very early stages of pregnancy, up to 10 weeks gestation. It is important to consult a healthcare professional before using levonorgestrel, and to follow the recommended dosage and usage instructions carefully to avoid potential side effects. Thank you for watching, and we hope you found this information helpful.